Good morning, everyone. Thanks for coming back for the second day. So I think yesterday we got a really good rundown on, can you all hear me all right? We got a really good rundown on the state of the research at the moment. There's some fantastic research that is already underway, and I hope that that's given you a really good overview of where we're going at the moment and what's happening at the moment. But what I think my job is today is to stimulate us all to think a little bit further ahead, to think about where we're going in the future and what sort of advances in technology are meaning for where we're going in terms of M-Health, particularly on this journey towards personalised wellness. So I've been lucky enough just recently to go to several quite future-focused conferences, both here in New Zealand and in the US. So what I thought I'd do to try and stimulate us to think more future-focused is to reflect on the themes that came through those conferences. And to talk about where people are talking about M-Health going and personalised wellness going. So I'm just going to go through a whole lot of themes and show you a whole lot of stuff. It may seem a little bit jumbled. It's certainly contradictory. The themes contradict each other. Some of them may be a little bit controversial. You may not agree with them all. But at the end, then I'll try and wrap that up a little bit into where we think this is going for our sort of research that you heard about yesterday. So that's the plan. Okay? So, and the first theme is that it's not about the technology. And I'm finding that the conversations are less and less about mobile health and less about let's just make an app for that. So if we look at the banking industry, what has happened there is that we've gone from having to go to a branch to being able to go to thousands of ATMs on streets all around the country, to doing internet banking in your home, to now having the ASB app on your mobile phone, and wherever you are able to look at all your balances, to move money around, and even to pay people directly on your phone wherever you are. And we're way behind that in health, but I think we're starting to get over that hype stage of everything has to be called mobile and called an app. When we're just starting to say actually it's just about health. And this is just how we do things now. This is how we do banking. We do it on the go. We do it when we need to, wherever we are. And that's where we're getting to with health, that people need to do certain functions in order to maintain their health and wellness, and they need to do it wherever they are, when they need to, on whatever technology they have with them. So we're starting to get over that hype phase about what is mobile and what is not, and we're just starting to think about health, think about the functions that people need to be able to do, the information they need to be able to access, and how we're going to help them to do that. And we've learnt that it's certainly not just about taking what we've done in multiple other ways and turning that into an app and putting it out there, because what we've ended up with is hundreds of thousands of health and wellness apps that are out there and are not being used, and they're not that useful, and there's no evidence that they're helping people. So I think part of it is that it's not about the technology, and there's this definite theme everywhere to being a more person-centred system. So putting the person at the centre of everything that we're designing, thinking about their problems. So starting with what are the problems, what are the issues, and then what are the things that we need to do to help them to address those, what are the solutions that we need to help them with, and then how do we deliver that in multiple different technologies? How do we give people options so that they can do the things they need to do wherever they are, using whatever means they have available to them and that they prefer to use. So I'm going to come back to this diagram later, but this is something that we've just put together to talk about some of the various functions that people are wanting to do wherever they are. They're wanting to access health information, they're wanting to access their own health information, they're wanting to access services to support them, to manage their condition, or just to be more healthy. So we'll come back to this a bit later. But here's the first contradiction. Here's my, it's about the person at the centre, but actually it's not about individuals, is it? Particularly here, we know it's about family, it's about whānau, it's about communities and caregivers and the people who are looking after people. So while we say it's a person-centred system, I am also looking after the health of my children, and I'm also looking after the health of my elderly parents. So my parents recently went on holiday. My father is 85 and on half a dozen medications, which he has no idea what they are or what they're for. And they got over to Australia and realised that my mother had miscalculated and they didn't have enough of his tablets for the whole time they were going to be away. And so I very quickly had to get up to speed with what medications he's on, whether they could be stopped, whether they needed to be continued. I had to talk to his doctor, get a prescription, organise with a doctor over in Australia to get them to manage the prescription in the pharmacy and get some medications to my father over there, which is all, you know, very doable now. But it's just a reminder that this is about, you know, whole families and whole communities and caring for each other. And when we're designing a system, particularly a technology-based system, we may not be designing it for the individual who's at the centre of it. We may be designing it for someone else in their community who's actually looking after them. And you heard a little about this yesterday with the text match program that Rosie talked about, that while the program is available for pregnant women or the mother in the family, it's also available for anyone else in that family who wants to be receiving the same messages. They're just framed slightly differently, but basically to help those other people in the wider whānau to look after the pregnant woman or their child in the family. And it's just a reminder too that we often think, you know, automatically that older people are not going to be using the technology and not looking after this themselves, but that's not necessarily true either. And these are just two older examples, I'm sure there are way more now, of smartphone programs that are being developed to help older people, people with cognitive issues or disabilities, to be able to use the technologies as they need to. So the one down the bottom is an app for a smartphone to enable people who have hearing loss to be able to hear better over their smartphone, so that they can personalise the auditory settings so that they can hear over a smartphone better. The one on the top is for people with visual difficulties, so it actually is a smartphone where you can, at the push of a button, raise the buttons for the letters, so that people who have sight impairment can still type on a mobile phone and create messages. But there's way more like this happening that will make even smartphones much more and more accessible for anyone. So the first theme was about, it's not about the technology. So the next few themes are all about the technology. And of course you want to see some cool stuff. So I'll show you some of the cool stuff that I saw while I was away. But the first theme is around wearable sensors, which you've seen a bit of over the last day as well. So, and the main themes here are around mainstreaming and miniaturization. And, you know, who would have thought that so many people in the world would be voluntarily wearing a health sensor, a health monitor? You know, if we'd set out to do this from a health service perspective or even from a research perspective, you know, we would never, ever get so many people wearing something to do, you know, to help them monitor their health. It just would never have happened. But what has happened is that companies like Nike and now Apple have put out these fitness trackers, and all of a sudden it's become, you know, a worldwide phenomenon. The rise in the use of wearable sensors and fitness trackers of any sort is exponential. It's greater even than the initial uptake of the mobile phone. It's just incredible how many of these things are being sold. And that it's becoming, you know, a fashion statement. So this has nothing to do with health whatsoever. But these things are incredibly useful for us in health. You know, this array down the bottom here on the right-hand side, those amazingly are all smartwatches, but these are sort of the fashion statements around smartwatches and what they can look like and how they're being marketed and sold now. But interestingly, the graph in the middle, what most people want out of a smartwatch, so, you know, a smartwatch was designed to be an extension of your mobile phone so that you could see messages and emails and take phone calls like a secret agent. But what people actually want on a smartphone are the health and fitness applications. That's the things that they're most interested in having on their smartphone, which is really interesting, and certainly, you know, nothing that we could have set out to do from a health perspective. And the different types of wearable sensors are also just increasing incredibly quickly. We all know about the Google Glass. And while, you know, it's not something that you see commonly around here, if you look at these figures, actually there are millions of them being sold around the world. So that's only likely to increase. And smartwatches, wearable 3D motion trackers, and smart clothing. And most of these, you know, people are buying them for physical activity and health monitoring. On this theme of you know, miniaturization and the advances in the technology and what that's allowing us to do, these are some of the new things that I've seen lately. So the one at the top on the left there is a new monitor, and this is commonly what the monitors are starting to look like now. This looks like a rubber band-aid, and you just sort of stick it on your chest, and then it's continuously measuring heart rate, respiratory rate, temperature. Some of them do blood pressure as well, and part of that is reusable and part of it is disposable. So you basically just peel off the disposable part, put a new one on and reuse it. Just becoming incredibly cheap and easy to use. And miniature, so this one here on the right, this is like a temporary tattoo. It's an incredibly sensitive and accurate temperature monitor, to the point where when you're wearing this, apparently they can tell if you are trying desperately to solve a very difficult maths problem in your head because of the very, very small differences in temperature that it's able to pick up. So apparently if you put it on one arm and you start rubbing your fingers, rubbing your hand on the other one, warming your hand up, you'll be able to detect this on the other arm. The one down the bottom is some of the advances in batteries. So batteries have been one of the main issues in sensors getting smaller and more wearable and more durable. So there are now very smart people who are developing batteries that are flexible and stretchable. So their battery is actually in a stretchable band around the arm there, and that battery is powering the smartwatch. So these sorts of advances just make what we can do with wearable sensors just, incredibly open, because these things are so small and so wearable and so usable, and also not just wearable but digestible. So this is the Proteus pill, which is being used in studies around adherence, which is the tiny, tiny little chip which is able to be put on top of pills. And so this then detects when a pill has been ingested. So normally with the state of medication adherence research, we know if someone's been prescribed it, we know if they filled the prescription, we know that they took it home. We can even know now if they take the cap off. But what we don't know is whether they actually put the pill in their mouth and took it. This is the next, the next stage, and that now we can tell if they're actually ingesting the pill, because the chip is ingested. They wear a patch on their skin, and that is able to pick up the changes in the medication from inside their gut, and that take place. So another form of miniaturization, you may have seen this one, is being talked about a lot because this came out of Google, but this is a contact lens that is able to do continuous glucose monitoring for people with diabetes. So just by wearing a normal contact lens for your own eyesight, it can have the tiniest little sensor embedded in it, which is then able to provide continuous glucose levels that can be used then to drive a person's insulin dosage. And these sensors also are becoming now woven into fabrics, so becoming so flexible and stretchable that they can be woven into clothing. So along the top, that just shows the progression of where we've gone from these very big harnesses that needed to be strapped on to the smaller sensor devices that can just be stuck on the skin, and now just into clothing. So all you're asking people to do is to wear a t-shirt basically, and then you can be continually monitoring their heart rate, blood pressure, temperature, respiratory rate, their movement. So these are used often in the military, or are now starting to be used in dangerous solo professions, where you would also be able to tell if the person had fallen over and hadn't gone back up again and they were on their own out in forestry or somewhere else. The ones down the bottom there are actually diabetic socks. So you may be aware people with long-term diabetes, it affects their blood vessels to their extremities. It also affects their feeling in their extremities, so they're not able to tell if they have hurt their toes. So these socks have sensors in them, particularly around the toes and the heels, and they're able to monitor the blood flow to the peripheries, and also to alert if the person has damaged their toes at all and are not aware of it. So, and this is just a really cool one that we just saw at a recent conference, a little bit of a side note, but I just really like it. There were some researchers at MIT Media Lab, Professor Rosalind Picard, who was doing research into being able to monitor the autonomic nervous system, which is a new thing that we haven't really been able to monitor before. But basically, By putting wearing sensors around the wrist, they're able to look at small changes in conductivity across the skin that tell you about whether your autonomic nervous system has been turned on, whether you're more stressed or less stressed, and your body's reaction to stress. And they were looking at this in kids with autism. And what they found in these kids with autism, whereas with a lot of other people they had been seeing very small changes in skin conductivity, reflecting the activity of the parasympathetic nervous system. When they put it on these kids who were very prone to epilepsy as well, a lot of them with their autism, they saw these most amazing peaks just prior to the children having an epileptic seizure. Which was really unknown beforehand, and then they started putting them on both wrists and realised that they got different readings from different sides of the body according to where the activity was occurring in the brain. And these very smart people have gone on to just develop this very simple system that is just a wonderful thing for parents of children with epilepsy, that it actually alerts them when this happens in their child, so that to say there's a chance that your child is going to have a seizure in the next 20 minutes or so, that you can go and then get that child to a safe place and be there to monitor them and look after them when that happens. So a wonderful system for these parents, make a huge difference to their lives. It's actually what they've done is fairly simple, but it came from this, really detailed research around monitoring the autonomic nervous system. And back to the mainstreaming, because I was going to say everyone carries one of these. I'm the M-Health person, and I actually left my mobile phone at home today. It's shocking, but I'm sure all the rest of you have one of these on you at the moment. And these are just passively collecting information all the time. This is mainstreaming data collection and sensors really at the ultimate, because there are more of these in New Zealand than there are people, and they are constantly collecting information, geographical information, things you may think are unrelated to health. Environmental information, just what you're doing on your phone too. So this one down the bottom is a company called Ginger.io that has been doing a lot of research into what they can passively collect from smartphones. So that means you're not doing anything to collect it, you're just using your smartphone as you normally use it. And they realised that they could collect things like how active you're being. So where you're going, how physically active you are, but where you are geographically as well, how much you're getting out and about. But also how you're using your phone. So how many phone calls you're making? What's the tone of your voice in those phone calls? Are those phone calls positive or negative? How many social networking uploads you're doing, how many tweets you're doing, how many Facebook status updates, and whether the text of those are positive or negative. And they can start putting all of this information together to get a picture of your normal daily life, how active you are, how socially active you are, and they've started turning this into interventions around mental health. So basically try and identify when people who are prone to depression are starting to get into that cycle of being less active, less social, more negative, less positive interactions going on, and can try and intervene at that point, can try and send messages and provide support for a person who is going down that pathway. So that's all just passively collected over your mobile phone. So this has all led to something that's called the quantifiable self movement, where people are starting to collect this sort of information. And these facts, these are old now, but these facts about people wanting to collect this information and wanting to share it with their doctors, that started to really worry a whole lot of doctors and a whole lot of health services and a lot of clinicians about this onslaught of continuous data that they might be expected to be looking at and communicating with their patients about. And a lot of this is continuous data we've never had before. We don't know really what the fluctuations in blood pressure in a person who doesn't have heart disease, we don't really know what that means because we've never really collected it and looked at it before. It's in such great detail and such amounts of data, and so we don't really know when to act. So it's started to get the health profession a little bit concerned, which leads to the next theme, is that it's actually not about the health system and it's not about health professionals, but it's about people, and it's about people wanting to monitor their own behaviour and monitoring their own body's responses to their lifestyle decisions, their medications, their activity, their diet, And it's the people themselves that are wanting this data and not necessarily the health profession. And we know this because we know that the sort of real-time feedback loop is incredibly motivating for behaviour change. This is what, where behaviour change comes in, really. That this sort of constant review of your own body's responses to those behaviour change choices is very motivating to get people to change their behaviour, to make more healthy decisions. So that's another theme, really, that real-time is really important, but it's not about providing real-time data to clinicians necessarily. It's about providing real-time feedback loops to the individuals themselves. And this is just another really cool example that we saw at this recent conference. So this is just a dad of a young boy with diabetes, and type 1 diabetes, and the young boy had a glucose monitor, but he was at school and the dad knew that the glucose monitor only got checked at regular intervals throughout the day, even though it was possible to look at the continuous data. The teacher would only be looking at the glucose monitor at morning tea and lunchtime and so forth. So the dad hacked his child's glucometer so that he could get the continuous glucose monitoring data. He could see that via the web, and he wrote a program around that so that it would automatically alert both him and the teacher in the school if the kid was suddenly getting dangerously hypo in the middle of a lesson, and the teacher would be able to act on it to give them some glucose or sweet or whatever in the middle of the lesson, rather than not actually knowing until the next break and the next time that they did the test. And it started this whole movement called Open Continuous Glucose Monitoring. This is his system that he developed. It's called Night Scout, but there is a whole sort of global movement now around open continuous glucose monitoring, which basically gives you instructions on how to hack various types of glucose monitors to be able to do this if you need to. So, and the other thing about real time, of course, is being able to get help when you need it in real time. And the example I wanted to give is just this one down the bottom, actually. Some researchers at the University of Wisconsin, Dave Gustafson, has developed a program for people going through drug and alcohol rehab, basically where the person who has given up but is having problems and they're trying to prevent them relapsing, they put in some information about where they used to go, like where they used to go to drink or where they used to go to get their drugs. And this information is in their mobile phone. So if they're on a bus and they're heading towards that part of town, the program will start messaging them and start giving them positive messages. If they keep going and they get too close, the messages get a little bit more strident. What are you doing? Don't get off the bus here. But it will also offer them help and support immediately. So they'll actually get a message saying, would you like to video consult with your clinician right now? And so even if they're on the bus, they're able to push the button yes and have a little video consult with a therapist to try and prevent them from that major relapse and to keep them going, keep them motivated to keep going. That's the sort of real-time support that could be provided. So all of this data that we're talking about then for the individual themselves, this was one of the themes that was mentioned at the conferences. The new guideline could be your own personal baseline. And then it's not so much about what everyone else is doing and the standard parameters of if you go above this or below that, but about actually using that stream of data on yourself to create your baseline so that you know when you've gone outside that. And this is one of the companies that is trying to do this in a fairly research approach. It's called PhysIQ platform. That basically uses those sorts of sensors that I've shown you before, the sticking plaster type sensors, and it analyses data over time to basically give you your baseline, your wellness index. This is your normal in all these parameters, and to only then alert you or to provide advice once you go outside the parameters of your normal, rather than over subjective guidelines that have been set on the means of loads of people. And this has sort of led to this movement around N of 1 trials. So basically this is saying that instead of N of thousands of trials and then the results that we look at are the mean or the average of all of those people and all of their different circumstances, the individuals are looking at their own trials of themselves. And particularly people who are trying different medications to try and find the one that suits them. This is the sort of process that they go through basically that they can be helped to do to randomly have one drug look at all of their body's responses, their physiological parameters to that particular drug, have a washout period, try the other drug and see what that does to them. And then they know which drug is most likely to be more effective or have less side effects for themselves. So this is sort of the formal way of doing it with a randomised approach, but there's also just a lot of people just doing this. And you'll see this if you go onto some of the patient community websites like Patient Like Me, is that a lot of patients are just sort of doing this stuff anyway. They're buying their own sensors, they're trying different things, it may be different diets, different supplements, different medications, and seeing what seems to work best for them, which gives them the most side effects, which seems to help them sleep the better, all these sorts of things. Eric Topol sort of talks about this as the democratization of medicine. And he describes this in a way where the health system used to be designed around a doctor and their black bag. And in their black bag they had their little tools and things that help them to diagnose and to treat people. So in the current day, the tools that are in that black bag have become digital and they've become connected. So we can start to collect the data from that and look at it over time and compare people and so forth. But the next step of the black bag is actually that the things that are in that doctor's black bag are no longer the domain of the doctor. They're actually consumer devices. They're being used by people on themselves. And that this is taking away some of the mediation of the medicalisation, if you like. The lower end, the more wellness end of the spectrum may well just be done before you go and see a doctor now, because you're able to do so much of this yourself. And it's related to that, the miniaturization and the devices getting smaller and cheaper and more consumer focused. So, one example, of course, is the stethoscope. The stethoscopes are now digital and able to collect that sort of waveform of the auditory data. But the one down the bottom there, that's a stethoscope that anyone can use. All you do is just hold it on your chest over your heart, and the sound waves are not just visible on your smartphone, but they actually can be connected, sent to a cardiologist or a GP, analysed, reviewed, listened to, and then a report sent back about the state of your heart valves. Even more so and more freely available is this. It's called the Alive Core. So I've got one in my bag if anyone wants to see it, because obviously it's not connected to my smartphone, which is not in my bag. But you are supposed to just connect this little two little sensors that you see there onto the back of your smartphone. You just hold it like this, so that you've got fingers on either side of it, and it takes what equivalent of a 3-lead ECG recording for 30 seconds. It's very high quality, a very good recording. It's not a 12-lead like they do in the hospital, but it's still a very high quality recording of the ECG. The smartphone app tells you immediately if there are any particular issues, but also you're able to PDF that recording, 30-second recording, and send it to your cardiologist or your GP to get further advice. So just to show you how we're thinking of using this sort of thing, what difference it could make. Currently, some of our cardiology outpatient clinics have very long waiting lists, much longer than we would like them to have for the people who have very serious heart disease. But there are a lot of people on those waiting lists who have palpitations, and the majority of those people will actually be well and will not have any pathology. And you can tell by the history and some of the signs and symptoms that people are low risk or high risk, but people are very reluctant to take them off to not see them. So what we're looking at doing is perhaps giving people at primary care, when they go and see their GP about palpitations, is that they could get one of these Alive Core to take home. Because of course the big issue is that we need to see what the ECG does when they're having palpitations, not when they're well, which is often when they turn up at the cardiology office, have the full ECG and other tests, but they're quite well and not having palpitations at that time. But with this on their smartphone, the minute that they get palpitations wherever they are, they could be taking a recording, sending it through to their GP, who could then say, actually, there's no need for us to put you on the waiting list for the cardiologist in the first place. Hopefully it will reduce our overall time for people being seen. So one of the other things that was brought up at these conferences were that a prediction that in about, I think he said something like 3 years' time, I'm not sure about that, there'll be a lab in every bathroom. So the other thing that is being miniaturised and made cheaper and cheaper all over time are laboratory tests. So these, you can see the size of it in the one up the top, but the next line is sort of what looks like in a bit more detail. Basically a microlitre of blood, whole blood, can be put onto one of these very small panels, and it weans its way around those loops there and can get tested for a number of different things all in the one go. It takes about 10-15 minutes, and you get little colours that tells you if it's positive or negative for various tests, so it can be read immediately by the person, as well as again being also being sent off for more detailed analysis. So there's so much that people will be able to do themselves. But I have to show you this one because this is just great. This I just saw at Health Informatics New Zealand conference. This was developed by Dr. Cheong, who's a ophthalmology registrar at Gisborne Hospital. And basically what used to take $30,000 of equipment to do a full eye exam, including a slit lamp microscope to look at the outside of the eye, and then a more in-depth microscope to look at the retina at the back of the eye, can now be done by these two bits of equipment and a smartphone app that cost approximately $100 and can be 3D printed. And actually you can just go to his website and download the 3D printing files and send them to someone with a 3D printer and build these. And then these can be used anywhere with a smartphone and these bits of equipment. Just amazing, really. And there's loads more examples of things like this too, where the equipment that we have previously used, totally the domain of the doctor, incredibly expensive, only available in hospitals, are being made smaller, cheaper. An ultrasound probe there again is approximately around $100 or $100 US, plugs into a smartphone, and an ultrasound can be done anywhere in the field. And the other one is a microscope, and there are various different microscope attachments for smartphones for different tests as well. But this is the ultimate. Does anyone know what this is on the left there? No Trekkies? It's a tricorder. So this is what Bones, the doctor on Star Trek, has, and he just sort of goes, and it tells them what's wrong with the person. And then, in later series of Star Trek, it was used by Spock, who is obviously not a doctor. So this is the consumerization of medicine on TV. So Qualcomm put out a $10 million global prize for someone to invent the tricorder. And there are 10 teams around the world putting hundreds of thousands of dollars and huge resources into building the tricorder. It has to be able to diagnose remotely around 15 different conditions and do around another 15 specific tests it has to be able to do. Scanadu is one of the companies that is in the final. This is just their current over-the-counter offering, which you just hold on your forehead, and it does temperature, blood pressure, heart rate, respiratory rate, I can't remember what else, quite a number of things, not the full panel, but it's part of their final offering, and they are constantly collecting all of that information, so you can see globally how many Scanadus are out there and their constant their monitoring results. So the tricorder X Prize is due to finish about halfway through next year. So at that point there should be at least one bit of monitoring equipment out there that could be used by anyone to diagnose remotely at least 15 conditions. So that's sort of going to one extreme, really, the really high-tech extreme, but the next contradiction is this theme which came through at one of the conferences too, that the vital signs of the next century really are activity, weight, sleep, food, and the exposome. So these are the things that actually people are most interested in monitoring and maybe most important in their wellness and their health. And the exposome is really just trying to sum up all of the exposures that people have, which includes all of these things, but there are others as well. Things that you're exposed to in your daily life and how these may affect your health and your wellness, which leads us, of course, to all the omics, which I'll just do very briefly because it's really not my field. But precision medicine, there's a national precision medicine initiative in the US which is aiming to recruit over 1 million Americans who will donate their genomic data to the NIH to be fully analysed and examined over the next, I don't know how long. But there's, the new theme is around precision health. That this isn't just about medicine, and this isn't just about cancer, which a lot of it has been around so far, and it's not just around drugs for cancer, but it's actually around health too. And so there's a field of public health genomics, or sometimes called population health genomics, which is about how can we use the genomic profile of people to actually improve their wellness and their health and to do better preventive activities rather than just looking at illness. And it hasn't got very far yet, but the most developed stuff at the moment is about looking at some of our screening programs that, one of the biggest problems with our screening programs is false positives, that you might tell someone that they could have a very serious cancer or disease and that could turn out to be wrong, and you might even go so far as to biopsy or to do other procedures and they end up not having it. So the idea with the public health genomics is that we'll be able to better target, because from our genomic profile we'll be able to get a much better idea of who is at risk of what conditions, and therefore our screening can be far more targeted to people who are at high risk. We won't need to screen other people, and therefore there'll be far less false positives, which could only be a good thing. It's only starting off in a couple of things, as you can see there, but the potential is much greater further down the track. And the next OME, which is the big trendy thing at the moment, is the microbiome. So this is the fact that you have 10 times more microbial cells in your body than you do your own human cells. And that this microbiome, your flora that you are carrying around with you, could have a major influence on your health. On one hand, it is a major indicator of your health. It is a major indicator of your exposures and your diet and your health at the moment, but it also may influence your health. And this is a very new field that is only just starting to be investigated, the links between your microbiota and your health. So if you want to know more about this, you can go to Indiegogo and join the uBiome project, where you sign up and to offer your microbioflora by doing a few swabs. That may be a little bit uncomfortable. And we won't need to go into right here, and that they will form part of this research project around how your microbiome affects your health. So just one more theme really. So we've talked about all this huge amount of data. So obviously there's a lot about data going on, but data on its own isn't going to help anyone terribly much do anything. So the next theme is around aggregation, integration, and what you do with that data, really. So there's a whole lot of companies that have spawned in this field trying to help people with this. This sort of thing where Validic has done the interface with over 200 different wearable sensors and will aggregate all of that information for you on a large scale so that you can see all of the incoming sensor data for a group of all the people in your health service or whatever. But also companies that try and integrate a real life service, face-to-face service, or a phone coaching service with the data to provide you with a more personalised system of support. So use your data for decision making, to help you to connect with your data and to use your data, but also a blended service, as Terry talked about yesterday, with some face-to-face or some phone-based coaching and counselling to try and really help you to make the most of what all that data is trying to tell you. Because we really need very simple graphical tools to help people to know what to do with this data. So while the data side of it may be very complicated and may be huge and complex and continuous, and that's giving people that isn't going to help them. It's what you do with that. And so these are just some very simple tools around the continuous glucose monitoring that graphically try to show people what this means to them and what they should do as a result of the data that's coming in. So this is the smartphone app, I guess, side of the data, and giving people with very easy to use decision support tools, alerts and reminders. And the other thing about integration is integration with other sorts of data. So environmental data, geolocation data, as I've talked about, the passive data on your mobile phone, social data, bringing that all together. This picture is about the Internet of Things. So this is the potential data that may be available from the things in your life. Your fridge, for example, which could tell you how often you've been there and what you've taken out of it and whether you should go back there again today or not. But also, when we were talking about the families earlier on, this is where we're going with the smart home idea of helping elderly people to stay in their homes for longer, because these sensors in the home will alert someone if an elderly person actually hasn't got out of bed today, or if they've just sat in their chair all day and they didn't turn the heater on or the TV on or anything. They just sat in the chair and they didn't move for the day. There's probably something going on there. They probably need a bit of help. They need someone from the family to pop round and see how they're doing. So that's sort of the other sort of data that can come from things that may need to feed into these programs to be integrated into it. So I said I'd come back to this picture. So the team at NIHI, we've been thinking about what all of that means for what we do and where we think we need to go with our research in the future. And so this picture is just trying to lay that out for us, that we think that there should be one portal, one point of entry into being able to access all the things that you might need. And that's the health information, searchable health information, your personal health information, the transactional things that you may need to do with the health service, as in booking appointments and prescriptions, having virtual consultations, looking at your patient journeys that you've had when you've been and seen someone in the health service, but also being able to contribute your own data, whether that's manually putting in your goals and wants and needs, your preferences with how you would like to interact with people and with your data, or whether it's automated by your wearable sensors and being uploaded into it. And around this, the important part for us is the behaviour change programs that we can put in to support people, that we want people to be able to access directly themselves, to choose what they want, to give us their preferences so we know what technologies they want to use, how they want to interact with them, and so that we can support them in their healthy behaviour change personalised programs. And they've got to be really easy to use. We know this. They have to be really graphical and video and auditory and very simple and very supportive for the individual at the level of health literacy that they want, where they are. So this is really what I think we're doing. We are still really, very much committed to the idea of mobile behaviour change programs. The first line is what I think we're already trying to do, anywhere, anytime, when they're needed. That's what our current programs are all about. But what we need to do is to think about real time, using that killer feedback loop from real-time data to providing them with the help and the suggestions that they need in the context of their lives, which we can only know about if we collect that data, integrated in terms of other information that came into it, but also integrated within the health system and with other IT systems. Where we really want to get to next is that these programs continue to adapt over time to keep people engaged and participating. To keep them really involved and interested. The program needs to keep getting better and needs to keep aligning with what their needs are as they change over time. And possibly the most difficult thing is, this has got to be for everyone, these programs. They need to be for those who are actually the unmotivated as well. A lot of what you've seen, what I've been talking about, are being used by the very highly motivated people at this stage, and that's either because they have a need, they have a chronic condition, or they're just, they're worried well, if you like, the people who are highly motivated to do this stuff. But we need to do all of this in a very passive, easy way for people who are not motivated as well. We need to provide these systems that are so integrated into their normal lives that it just sort of happens for them. And the way to do that is through their mobile phone that they're carrying around with them all the time. So that's all I had to say. Thank you very much.